Jason, good evening. How are you?
Wonderful. How are you?
All's good in the world. We're talking today about, we were talking off air about how it's no fun getting old.
No. Better than the alternative, though.
It is, right? But isn't it amazing how when you're 20 years old, you can do almost anything and there's no aches and pains.
Yeah.
And now we do a little bit of stuff and it's like, oh, boy, the aches and the pains and
popping the Advil,
thank
right?
Thank God for the Advil.
Yeah,
But one of the big challenges, Jason, right now, we have an aging population here in Canada. And on today's show, we're going to talk about the biggest health risks facing the Canadian medical system. And this is a bit of a concern for me, right? So we're at an age in our lives where, the next 10, 15, 20 years will be, like I'm 55 and you're 56, I think. Are you 56?
Just turned 57.
57, right? Yeah, exactly. Happy belated birthday.
Thank you.
So, but 10, 15, 20 years out, we're going to have to start using the healthcare system, right? And, you talk to a lot of seniors right now and it's not a good story. It's a really difficult time. I think if you're a hospital, you're understaffed and you've got all this aging population, and there's a bunch of issues facing our system right now. And I'm hoping that at some point down the road, our governments can figure out a better way to do things. But, one of the key points here, Jason, is, again, Canada has an aging population. So right now, as the population ages, there's going to be an increase in chronic disease, healthcare needs, and it's putting a ton of strain on the healthcare system. With chronic diseases right now, conditions like diabetes, heart disease, and obesity is rising, which requires long-term care and management. And it's really straining, the doctors and the nurses and the providers that are trying to, as best as they can, take care of their patients.
Yeah, exactly. I mean, diabetes and heart disease, they are, 2/3 or something in the United States? 2/3 are either pre-diabetic or diabetic. I mean, talk about strain on the healthcare system in the States and pretty much in Canada as well.
Well, the thing is, right, is you don't take care of your body. You eat what you shouldn't eat, you drink what you shouldn't drink, and you smoke what you shouldn't smoke, and all of a sudden you wake up one day and you're like, whoa, where did all this come from, right?
Exactly. One of the other issues facing the medical system, of course, is the mental health issues. So that's something that's really taken, become popular, but certainly become prevalent in our society is the mental health issues. Big growing concern. They're more prevalent. The access to mental health services is lacking still, and so there's a lot of things that are untreated, a lot of conditions.
The thing I find about mental health is it's more relevant now than it ever has been, but I don't recall maybe it being as bad as this 25 years ago, maybe 20 years ago. So you wonder, what's the change? Was it always here and we just didn't diagnose it, or are we overdiagnosing it now? Like it's a pandemic right now when it comes to that.
Absolutely. I think it's a little bit of everything, right? Yeah. One of the other issues, of course, is wait times for treatment. I mean, we talk about this a lot, and we see it. Everybody's got a story about wait time issues. Canadians are facing longer and longer wait times for surgeries, specialist consultants. I've had a family member have to wait 18 months for just a specialist. So that's obviously leading to some worsening healthcare outcomes.
Well, it's amazing, right? So if you need a hip replaced and you're not at the top of the list of urgency, you've got to live with that illness for, 6 or 12 months. So then other things, you can't work out, you can't walk. So then you gain the weight, but the wait times are difficult. And, one of the things when you talk to folks these days is you can cross the bridge and go to Buffalo and there's no wait times. One of our friends works in Buffalo. She's in the healthcare profession. And we knew a person who had a cancer issue, and the wait time was going to be 4 to 6 weeks to get all the diagnostics done. And she said to her, pay the $10,000 or $12,000, cross the bridge. We'll do it in 2 or 3 days, right? So
there's no price tag on health, right?
Yeah, absolutely. Yeah. Another key point here on some of the risks facing the Canadian healthcare system is the healthcare workforce shortages. You've got staffing is leaving. You've got staffing retiring. I mean, a lot of nurses have worked really hard, long days, hard profession, and they want to get out as soon as they can. There is a shortage of really qualified healthcare professionals, including doctors and nurses. which obviously can reduce the quality of care, and it's going to increase the workload for existing staff. And, again, finding good doctors that can handle these issues. Finding a good family doctor is even difficult these days, right?
It absolutely is. Yep. And some don't even have one, right?
So, exactly. And, if you're lucky to live in Niagara or Toronto or the bigger cities, it's fine. But, access to care in rural areas is difficult. You've got people living in rural areas, remote areas that have really limited access to healthcare. And you think about the fact that if over a period of time you're not on top of your healthcare, there's a point where maybe you can't get it back. It's just so bad where if you have access to good healthcare in your 20s and 30s and 40s and 50s, maybe you can prolong some of those chronic illnesses that are going to happen north of 50, north of 60, right?
Agreed. It's about being proactive, right?
Exactly.
Yeah. One of the other issues, of course, is the pandemic preparation. So, of course, COVID-19 highlighted some of the weaknesses that we have in our healthcare.
Yep.
And, hopefully not, but there might be some kind of outbreak at some point in the future. And that's, then we've got to be better prepared for it. And we went through 2019-20, so we should know what we're doing or what we're dealing with. Another issue, drug prices. Of course, it's wonderful. The medical industry is coming out with some amazing drugs to assist us with some of our conditions, but they can have some high prices. Some of the cancer drugs and stuff are $10,000, $20,000, which can obviously make it difficult for patients to afford those drugs. Exactly.
Number 9 here is Indigenous health disparities. So if you're living in a community with the in poorer health outcomes, access to health care is impossible. And I have a friend of mine who works at Orange Helicopters, and he flies up north and he deals with the Indigenous people, and they're in the middle of nowhere, right? So they have a health issue, and obviously they've got to fly an airplane in or fly in a helicopter and take them 2 or 3 hours by air. So not having access to that is really really difficult. Also, too, you've got new healthcare technology integration. We do need to modernize our healthcare. We do need to make sure that we have integration of healthcare technologies like telemedicine right now. But again, it's not for everyone. And if you're a person who isn't able to make the phone call, go online, that makes it difficult as well. So I think we have to use technology in a way that hopefully can help the medical profession. And a key thing here too, Jason, is even with new AI and with new technology for helping family doctors getting a better diagnosis, a quicker diagnosis, we need to get modernized on our technology platforms.
Agreed. And the final point is preventative care gaps. So focus has been on treatment. There's a focus on being, as I mentioned before, reactive. The emphasis is on treating the illnesses. And like you had just said, maybe we should start talking about being proactive. What are you doing in your 20s and 30s and 40s to prevent some of these chronic diseases, or at the very least, extend your life, your health, instead of dealing with putting a Band-Aid on things?
Well, it's amazing, right? When you're married to a doctor, as I am, I'm fortunate enough where I get yelled at if I don't get all my medical stuff done. But it's amazing, right? So I've got a wife who's helping me, again, refer me to my doctor, but getting, doing a lot of blood work, getting things done, getting testing done, maybe paying for some services as well. And even though, you look at a person and go, wow, he looks really healthy, fiddle, you do a deep dive into their blood work, into their cardiovascular and things like that. And you find some issues. And I always say that I'd rather find my issue at stage 1 as opposed to stage 4. I can fix stage 1 of heart disease, stage 1 of high cholesterol, stage 1 of whatever. But when it gets to stage 4, it's difficult to fix. But the conclusion right now is health is going to be a significant challenge for Canadians and the Canadian healthcare system. So addressing these issues will require coordinated efforts from government, healthcare providers, and communities to ensure accessible, equitable, and a high quality of healthcare for Canadians. So hopefully, with the new government, they decide that, we should start putting some money into our healthcare system, because really Canadians, listen, we pay enough taxes. We deserve to have a better care system than we have right now in this country.
Couldn't agree more.
Yep.
Yep.